Hello everyone, I want to use this short video to help you understand the nature of the centrum contact. Now the centrum occlusal contact is that we believe gives the body the best chance of having strong contraction and coordinated oral muscle function, which will lead to a more stable joint and obviously better health for the patient. So I described it as a little bit like a spoon. So here we have a spoon, and I want you to imagine that this is the receiving area on the lower left second molar. And as I move to my right, then we will have contact on the balancing side, on the opposite side to the movement. This goes against much occlusal teaching, where you're supposed to get immediate disclusion. But we know from our study clubs that we have found 100% of dentists, even those that have been equilibrated, have a balancing side contact in function. So here you go, there's your receiving area. This illustrates the cusp, which would be the palatal cusp of the upper second molar on the left. So you can imagine straight up and down, and then we need freedom in centric, okay? So that's where you've got this little bowl. So that freedom in centric allows the mandible to slide around a little bit, and there's still contact there. And this happens in function. It's not in your normal gliding contact, but Bayron's work in 1964 tells us that actually the occlusion changes when you really function, when you use active muscle contractions, not passive gliding movements. So you bite together, you're chewing or you're sliding around a little bit, and that's that freedom in centric contact. Then as soon as you move to the opposite side, so my mandible is now moving to the right, it'll glide up that little guide. This is not an interference, this is a non-balancing guide. So that's the handle of the spoon. So the initial contact is in the bowl, there's a little bit of freedom in centric, and the first millimeter or so of excursion to the opposite side is a contact on the handle of the spoon. It's only the first millimeter or so though, so remember that. As you move to the right, in my case, you will then go onto the canine or the premolars and have canine guidance or group function. But freedom in centric, which is that little bit of movement that the mandible can make, okay, with the back teeth in contact, that is on the balancing side. So I hope that makes sense. Start looking at the back of the mouth when you're checking people's occlusion, and you'll start to see little flat areas on the distobuccal cusp of the second molar and first molar, and you may well even see a little bowl there in the older patients as well, especially if they've had amalgam or composite fillings. Hope that helps.